Hi everyone, this is the cross anatomy lecture on the abdomen section, and in this we are going to focus on the rectus sheath. As the name implies, the rectus sheath is the aponeurotic sheath which covers the rectus abdominis muscle. I will request all of you to please go through my video on the abdominal wall muscles to learn their anatomy and their attachments before we begin with rectus sheath today. So this side shows the anterior view of the rectus abdominis muscle, which is completely covered by this aponeurotic sheath. These are the tendinous intersections of the rectus abdominis muscle, to which the rectus sheath is firmly adherent. On the other hand, this side shows the posterior view or the inner aspect of the rectus abdominis muscle, in which the rectus sheath is not completely enclosing the rectus abdominis muscle. It is absent above the costal margin and below this line, which is the arcuate line. On the posterior aspect, the posterior wall or the lamina of the rectus sheath is not firmly adherent to the rectus abdominis muscle and is incomplete, as we discussed, at two levels above the costal margin and below this arcuate line. This inferior limitation of the rectus sheath is known as the arcuate line, the other name for which is linea semicircularis. In the midline, the aponeurosis of all the muscles of the abdomen, they form a tendinous structure extending from the xiphoid process to the pubic symphysis, and we name that structure as linea alba. Along the lateral border of the rectus abdominis muscle, where there is limitation of the rectus sheath, this line is referred to as the linea semilunaris. So this midline is the linea alba. The inferior posterior limitation of the rectus sheath is the linea semicircularis or the arcuate line, and the lateral limitation of the rectus sheath is the linea semilunaris. The undergraduate students are usually asked to explain the formation of the rectus sheath at different levels. So the question that comes is the formation of the rectus sheath at three levels. The first level is at the level above the costal margin. The second level is the level which is achieved with the dissection between the costal margin and the arcuate line. And the third level is the rectus sheath formation below the level of the arcuate line. So these are the three levels in which we will discuss the formation of the anterior and posterior walls of the rectus sheath. Generally, the rectus sheath is contributed by the aponeurosis of the three abdominal wall muscles, which include external, internal oblique, and the transversus abdominis muscle. I will draw the cross section of abdominal wall muscles to show the formation of the rectus sheath. First one is the level above the costal margin. When we do the cross section at this level, we appreciate rectus abdominis muscle in the midline, and laterally we have three abdominal wall muscles: external oblique, internal oblique, and transversus abdominis, which have their own aponeurosis. At this level, the anterior wall of the rectus sheath is contributed by the aponeurosis of the external oblique muscle only. So, rectus sheath is formed by the external oblique aponeurosis on the anterior side at this level. However, the posterior wall is deficient, and rectus abdominis muscle rests directly on the 5th, 6th, and 7th costal cartilages, as the rectus sheath is deficient. Secondly, we will discuss the formation of the rectus sheath at the level between costal margin and the arcuate line. Here the anterior and posterior walls of the rectus sheath are present. Once again we have rectus abdominis muscle in the middle line and the obliques and the transversus abdominis muscle laterally with their own aponeurosis. At this level, the anterior wall of the rectus sheath is contributed by the aponeurosis of the external oblique. An anterior lamina of the aponeurosis of internal oblique which has split here, enclosing rectus abdominis from anterior and posterior sides. Transversus abdominis muscle contributes in the posterior wall formation along with the internal oblique. So we have anterior wall contributed by external oblique aponeurosis and anterior lamina of the internal oblique, while the posterior wall is contributed by the posterior lamina of the internal oblique aponeurosis along with the aponeurosis of the transversus abdominis muscle. Below the level of the arcuate line, rectus sheath is present only on the anterior side of the rectus abdominis muscle and posteriorly it is deficient. So here the rectus abdominis muscle is covered by the rectus sheath which is contributed by the aponeurosis of all the three muscles including external oblique, internal oblique and transversus abdominis muscle aponeurosis. And posteriorly it is absent. So rectus abdominis muscle here rests directly on the fascia transversalis and is not covered by the rectus sheath. The three muscles of the abdomen contributing in the formation of rectus sheath anteriorly, while posteriorly rectus sheath is absent below the arcuate line. Lastly, we need to learn the structures which are found within this rectus sheath. These include muscles like the rectus abdominis, Pyramidalis. The arteries found within this sheath are the superior and inferior epigastric arteries, which anastomose inside this sheath. The accompanying venae committantes, superior and inferior epigastric veins. The superior epigastric vein drains into the internal thoracic vein, while the inferior epigastric vein drains into the external iliac vein. And lastly, among the nerves, we have terminal part of the lower 6 thoracic nerves. So that's all about the rectus sheath, including its formation, contents, and the basic anatomy.